and race. My injury started way back in 1994, I think it was, may have been 93. Playing basketball, someone jumping up for a rebound, and they mistimed their jump, and his entire body came down on my shoulder as I was going up. And I felt paralyzed actually for a moment there. I slumped immediately to the ground. I couldn't hold myself up, immediately crumpled to the ground. I told my friends just to leave me there for a second because I couldn't move for a moment. I was pretty freaked out for a quick moment there, but I was able to move a little bit again. I went and saw a doctor. They did an x-ray, found out I had a herniated disc in my lower back from the injury. And they said, well, that's just what you'll have to live with. The only way you can get rid of it is with surgery. Other than that, you can just, do lots of exercises, keep your core strong, and it'll alleviate the pressure off of it, but it'll never get better. The only thing that can ever make it better is surgery, and even that's not a guarantee. It could make it worse. So I never opted for that. So I just lived with it for a while, and then it just started getting worse and worse, and then my back would throw out every once in a while, and it would get, to the point where I couldn't get out of bed. I'd have to roll out of bed. Some of you have probably tried that one, right? The old, okay, I can't actually get up, but I can roll out of bed and fall onto the ground and then walk around the house like this. Yay, look at this. That's not a way to live. So I decided to try to see some chiros, and I saw chiropractic, and it helped a little bit. It was a little bit relief, but actually while I was seeing my chiro, my back went out again. Same thing happened again. So I was like, well, I don't know if that's working too much. And insurance problems and things like that, I decided, I'm just not going to start doing this. It didn't seem worth it anymore, so I just stopped doing that. Just hope for the best. But it just kept getting worse and worse. I was able to do less and less during my day without acting up, and I'd have to go lay down on the flat ground and let my back rest for a long time before I could get back up and start doing things again. So it was miserable. It just took away everything. I couldn't play basketball anymore, that's for sure. Trying to play basketball, even jumping up and down once or twice, immediately would aggravate it. I'd be like, that's it, done. My lifestyle, things I wanted to do are over, and I guess I'll just have to deal with it, find something else to do with my life. Until I heard about Specific and did some research and was looking online, and I just got my master's in social science, so I've gone to college. I've got some type of education, so I can self-educate myself. I'm a good researcher, so I was reading, and I'm like, this totally makes sense to me. Absolutely. To me, it's almost a no-brainer. I can't believe this isn't more popular, this system of chiropractic care. I just can't believe it's not working. Well, maybe it doesn't work. Maybe that's what it is. Well, I want to give it a shot. I'm willing to try because I've tried everything else, and I'm not going to start doing drugs, and I'm not doing back surgery. I just refuse to do that. So I tried it, and immediately, for my very first visit, already I could feel some relief. I was like, are you kidding me? That's weird. I believed, on paper it made sense, but then you actually go do it, and okay, you're just going to do that. Okay, up there, that's it? I'm like, what about down here where it really hurts? But no, it's amazing. I can actually do a little bit more this week, and I'm going to get another adjustment. I can do a little bit more. And I started doing some of the things I was supposed to be doing, not doing them like I'm supposed to now. I need to get back on that, but exercise more, eat better, lose a little bit of weight, that always helps, and the stretching. And I do still do my stretching pretty good, but I need to pick up on my exercise more and strengthening my core, because I know if I was doing that, where I'm at right now it'd probably be double. I think I'd probably almost feel completely better, I think, if I was actually doing the other things I'm supposed to be doing on a regular basis. I've just kind of been in that celebration mode still a little bit. It's like, oh, a little bit of relief. I'm going with it. I just want to celebrate this for a while. But now I'm trying to get back on my regimen, because I do want to finish getting completely healthy so I can do things that I used to do, which I'm starting to do a little bit more. I can play basketball with my daughter now for a little bit. Not as long as I'd like to. I still, it still gets sore down there. It'll tighten up, but it takes a while now. I can do a lot more. I can jump. I can show her how to play basketball, and I coach her, and that's kind of nice to be able to do. And I'm looking forward to be able to do more of that as I continue to get this help and to do the things that I'm supposed to be doing on my end of the bargain, which I haven't really been living up to. And I know if I did, I would be feeling a whole lot better. So I want to feel all the way back to normal by the end of it. And I think I got hope much more than I ever did in the past, that's for sure.